A'udzubillahiminasyaitonirrajim. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And now we are going to actually move to our next lecture on the design of radiopharmacy lab in a hospital setting. So I'm hoping that at the end of this lecture, you will be able to understand the operations and design element in an ideal nuclear pharmacy facility. And I hope that you actually know the classification of the radiopharmaceutical preparation facilities. The general policy of radiopharmaceutical preparation facilities actually covered the principles behind it, as well as general operational and development principles. So in terms of the principle, radiopharmaceuticals are classified as the medicinal product. Thus, it shall be prepared in accordance to the good manufacturing practice, GMP, or good preparation practice, including their preparation facilities in hospital as well as other healthcare establishment. So the radiopharmaceutical preparation facility, or formerly known as hot lab, um, um, is built within or in close proximity to the nuclear medicine department. This is actually to ensure and facilitate the administration's activities. So, the commonly used radiopharmaceuticals in healthcare establishment can be categorized into a following list. The first one is the kit-based radiopharmaceuticals, where we can actually put our technetium-based radiopharmaceutical, technetium MDP, technetium tetraphosphamide, DTPA, and others. Then we've got the Safee, the PET radiopharmaceutical, whereby some people might need, obviously we might need the cyclotron if you're going to produce the PET radiopharmaceutical. But in addition to this, we might also have the PET radiopharmaceuticals generators, And we've got the radio-labeled blood preparations, as well as radioiodine, and the other one is the ready-for-use radiopharmaceuticals products. So, in terms of general operational and development policy principles, it need to cover on the radiation protection and safety, the quality assurance of the radiopharmaceuticals that are going to be prepared, the requirement on the premise as well as the equipment, and in terms of the personnel who actually working there need to be competent and have a proper training that they undergone. So, in working with a radiopharmaceutical, account has to be taken not only of the national laws on the preparation of drugs, but also of the other national requirements for the Occupational Health and Safety, Malaysian Atomic Energy Licensing Act 1984, as well as Radiation Protection, the Basic Safety Standard Regulation 1988. So the radiopharmaceutical preparation facilities shall be in or near the hospital nuclear medicine department to minimize the travel of the radiopharmaceutical or radioactive materials. And these radiopharmaceutical preparation facilities shall be specially designed to take into consideration aspect of radiation protection in accordance to as low as reasonably achievable ALARA, in addition to the cleanliness as well as the sterility aspect. So this facility shall be designed and built by a qualified contractor. So this is one of the very important things that when you have any plan of making up a radiopharmacy lab or nuclear pharmacy facilities, you have to ensure that those contractors has experience on building it, or else you might get something that out of the specification that it should be, because if those contractors are well known of built in the clean room, it is not enough, because we are also dealing with the issues of radiation protection for the clean room of radiopharmaceutical preparation facilities. So the presence of high levels of radioactivity shall be used as a factor in considering its proximity to the gamma camera, patient waiting areas, offices, and working area above and below the radiopharmaceutical preparation facility. So we have to bear in mind that those area is not that so close with our radiopharmaceutical preparation facilities, because it will actually give extra radiation to other people who are doing things around those areas. Appropriate measures shall be taken to avoid the spread of radioactivity from the control area, and to protect the control area from particulate and also bacterial contamination. So if the design permit a centralized radioiodine preparation facility is preferable, because this will actually minimize the space consumption, as well as better management of personnel, as well as radiation control. So what I mean with a centralized radioiodine is a central preparation that been done for this radioiodine, and it is not done at those each facilities of the nuclear pharmacy. So the risk management level shall be in accordance to the type of radiation emitted and the half-life of the. So you have to identify if it's a PET radiopharmaceuticals, the risk might be higher because they have a high energy beta. It's a high energy beta. And as well, if it's you're dealing with the radioiodine with a very longer half-life, obviously the risk is higher compared to what you're using compare with you're using these technetium 99M. So attention shall be paid to the prevention of the radioactive contamination, as well as management of the waste disposal. Meaning to say, if it's got a longer half-life, you might retain the waste disposal for quite a long time. So you have to have a very dedicated store to ensure that you store those radiopharmaceuticals accordingly. So you just don't mix everything all around, because you just don't know later which one of the waste can be disposed and which one is still not yet at the background level, which you have to keep. So water shower shall not be installed within the production area, as it may spread the radioactive contaminants to other parts of the body and the environment. So contaminated and used vial and syringes shall be disposed of safely and appropriately. So lead shielded waste containers for the used syringes shall be located as close as possible to the location of the use. So you don't have to bring up it's all around so that it will radiate those personnel around you. Even of radiation protection and safety, consumable items that have been used for dealing with radioactive must be kept in a lead-shielded containers or area. Radioactive detector with alarm system shall be made available in the appropriate area. So the detector shall be maintained regularly. Workstation in which a radioactive material emit gamma or high energy beta radiation shall be shielded with appropriate material suitable for the radiation protection. So there must be sufficient space behind the shield for the use of remote handling tong. An emergency or decontamination kit and eye wash facility should be provided at the appropriate areas for use in emergency. So in terms of quality assurance, as I've mentioned in the previous slide or previous lecture, the preparation of radiopharmaceuticals shall be carried out by the nuclear pharmacists or by other qualified personnel under immediate supervision of nuclear pharmacies in the radiopharmaceutical preparation facility. Generally, sharing of preparation facility between sterile and non-sterile products shall not be allowed. However, low usage sterile radiopharmaceutical products such as yttrium ibrutinib for radioimmunotherapy might be prepared in the non-sterile preparation facility such as radioiodine under the following condition. The sterile product preparation shall be done in the negative pressure laminar airflow isolators. All requirements for sterile preparation procedures shall be complied with. Procedural control shall be in place to ensure complete segregation of preparation activities of the both product. So in terms of the personnel required to work in radiation, control and clean room area, they shall be selected with care to ensure that they can be relied on to observe the appropriate codes of ethics, and they shall be free from any diseases. So this is the important that those pharmacies or personnel need to undergo the medical examination before they start work in our facility. Personnel dealing with radioactive materials are required to follow the requirement of radiation protection and the basic safety standard 1988. So these include medical checkup and personal dose monitoring. So personnel working in radiopharmaceutical preparation of a clean room shall be qualified according to the approved personnel qualification procedures. Apart from GMP, GPP, they shall also be trained with the principle of national as well as international radiation safety guidelines and policy. All personnel should be trained and assessed continuously and appropriately according to their job function. There shall be sufficient personnel for efficient and effective operations of the preparation facilities. Radiopharmaceutical products shall be stored, processed, packaged, and controlled in a dedicated and self-contained facilities. Normally, direct access to the preparation areas from common corridors shall be avoided. So we used to have from the main corridor, we should have an entrance to the area, whereby inside the area then only an entrance to our radiopharmaceutical preparation room. So the bioburden of all materials that been brought into in production area should be minimized. So appropriate facility for cleaning down the materials shall be made available. And all preparation activities shall be done according to the approved procedures and are recorded in the appropriate batch preparation record. Upon completion of the preparation process, all finished products, including radiopharmaceuticals, shall be labeled and tested accordingly prior to. So in terms of the preparation area, it should include clean room which need to be maintained regularly according to approved PPM, and the housekeeping utensils such as mop shall not be shared between production and non-production area. Our air conditioning should be separated between the radioactive and non-radioactive areas, and the recirculation of air extracted from the area where radioactive products are handled shall be avoided. Air from the operations involving radioactivity shall be exhausted through the appropriate filters that are regularly checked for the performance. And air outlet shall be designed to minimize environmental contamination by radioactive particles and gases, as well as appropriate measures shall be taken to protect the control area from the particulate and microbial contamination. So the preparation of sterile radiopharmaceuticals shall be carried out in a positive pressure clean room with a negative pressure airlock. So we want to make sure that the particle is going up to the negative pressure airlock. Okay, so the negative pressure shall be efficient to ensure containment. Entrance and exit of the clean room shall be via a containment airlock or a sink airlock. So it's going to be a negative sink lah. Air pressure gauge shall be installed at appropriately location normally right outside the clean room lah, so that it's easy for us to do the monitoring of the differential pressure for each room. So a control panel for monitoring of clean room temperature and humidity shall be located immediately outside the preparation area. So we have to consider to have this output like this in the future, whereby we can actually print anything. The building design shall take into account the flow of the materials, product, and personnel. The personnel, equipment, and work in process shall not be moved through areas in which other operations are running. So, in terms of a drain for radioactive effluent, it shall be built to facilitate maintenance, cleaning, minimizing the risk of contamination to other building areas, and connected directly to the decay tank. Material used for building and rooms shall be appropriately selected to facilitate cleaning and also sanitation process. The spec of radiation protection shall be taken into consideration. If the design permit, viewing glass shall be made available at suitable location, for example, at the preparation room, away from radioactive sources for supervision purposes. And all major equipment such as hot cell, the radiopharmaceutical laminar flow, negative pressure isolators, as well as dose calibrators shall be qualified and routinely calibrated. So floor, benches, and other work surfaces shall be sufficiently strong to bear the weight of the shielding, because you have to bear in mind our isolator or laminar flow cabinet it's very, very heavy because it had the lead shielding around it. So hot cell used for processing and filling of sterile radioactive substance shall be grade A quality. The background shall be grade B if we are using the hot cell cabinet, and grade D if we are using hot cell. An unsterile radiopharmaceutical product shall be prepared in a negative pressure control area to protect the external environment from the radioactive contamination. And the workstations such as laminar flow, safety cabinet, or negative pressure isolate need to be used for the protection of the personnel, or people call this as a primary engineering control. Yeah. So in terms of the quality control, in the quality control rule, due to the short half-life, a prepared radiopharmaceutical can be released and administered to the patients immediately without going through the full test of quality control. Yeah. However, there shall be a written procedure detailing all preparation steps and quality control data that shall be considered before release. The QC lab shall not be built inside the radiopharmaceutical preparation room. So preparation activities, I can share the same QC lab except for the blood labeling activity. And apart from radioiodine and ready for use radiopharmaceutical, QC activities shall be carried out in a separate designated quality control room. So the space of storage area shall be sufficient to allow orderly storage of various categories of material and product. The non-radioactive material shall be stored in accordance to the good storage practice, the GSP. And each radiopharmaceutical preparation facility shall have dedicated store for radioactive materials, non-radioactive materials, as well as radioactive waste. However, this room can be shared between all the activities carried out within the nuclear medicine department. And then the appropriate transportation aids such as trolley shall be used to carry heavy radioactive sources like our technetium-99M generators, phantoms, and others. A separate designated storage area for radioactive and non-radioactive material shall be provided to minimize radiation exposure. So the requirement for radiation protection shall be complied with. So as I've told earlier, we have a commonly used radiopharmaceuticals such as listed here. So if we can go to our first one, which is the kit-based radiopharmaceuticals. So this is an example for the kit-based radiopharmaceutical. It goes to the same, the principle. The personnel need to be appropriately trained and qualified. They have need to have the proper training and must be competent. And the shall be produced. The preparation shall be produced in qualified clean room facilities, and they might need a dedicated air conditioning system for its preparation. The clean room shall be designed and built by qualified clean room contractors, as I mentioned just now. The proposed layout, grades, and control parameters shall be submitted to the National Pharmaceutical Control Bureau, or now National Pharmaceutical Regulatory Agency of the MOH, for an approval. And the clean room, upon commissioning, the clean room need to be tested by an independent third-party agent, and these agent they shall be certified by the NATA or an EBB. So prior to use, the cleanroom facility shall be inspected and qualified by auditors from the NPRA, National Pharmaceutical Regulatory Agency of the Ministry of Health. So that subsequently approval letter for use shall be issued. And then confirmation on the radiation safety aspect, it will be catered by our Radiation Health and Safety section of Engineering Services Division of the MOH. They will be in the disqualified clean room facilities will be inspected routinely by our MPRA auditors. Calibration of equipment, including monitoring devices, shall be conducted by an accredited agent. They need to be maintained regularly according to the approved ppm, and the maintenance shall include through thorough cleaning and testing by the certified testing agent, and obviously microbiome monitoring shall be done regularly depending on the usage of the facility and outcome of the test results. In terms of elution from generators, preparing, including radio labeling and dispensing of radiopharmaceuticals shall be done in a grade A workstation. Access to the control area shall be via a gowning area and be restricted to the authorized personnel only. And the kit-based radiopharmaceutical preparation room can be shared with the preparation of the radiopharmaceutical for radioimmunotherapy. So this is some information about the layout, the design and specification. It need to avoid mix-up or cross-contamination between product. Rooms such as stores, radioactive waste, and quality control room can be shared with others. The building design it need to take into account the flow of the materials, the product, and also the personnel. Yeah. And then the entry, flow, and exit patient and staff also shall be separated from the entry, flow, and exit of these radioactive materials. So ideally, kit-based and radio labeling facilities shall have the dedicated room for all those stated in this slide. And dedicated air handling system shall be required for sterile preparation facilities, and they shall be fitted with alarms so that the working personnel are warned of any failure. And the system shall be able to maintain 24 hours pressure differentials without cooling whenever the facilities are not in use. And obviously, adequate lighting shall be provided with 5 to 600 lux ensures personnel comfort and ability to perform efficiently and effectively. So, and the others that you might need to acquire. In terms of the choice of construction materials, I think the ceiling, wall, floor, fixtures, shelf, counters, and cabinet, they need to be resistant to sanitizing agent and crevices free. Okay, so hopefully it will be long lasting. Construction materials, we have to use something that able to resist chipping, shedding, flaking, oxidizing, as well as deteriorate. Junction of walls, of floor and ceiling, it need to be curved to facilitate cleaning. There shall not be horizontal fixed pipe or conduits over exposed component. In process materials, drug product and drug product contact surfaces, airtight ceiling and walls, closed fitting doors, and sealed light fitting shall be in place, as these have an impact on the HVAC system, our heating, ventilation, and air conditioning. So for existing facilities, a certified agent shall be appointed to test the performance of the facilities on a regular basis. Kit-based radiopharmaceutical preparation and radiolabel blood preparation shall be performed in a separate workstation to prevent a cross-contamination. And all surfaces shall be made out of material easy to clean, disinfect, and decontaminate in case of radioactive. So this is other part of facility requirement that you should have a look into, yeah, for preparation of any radiopharmaceutical preparation healthcare establishment. Something like our personal changing room, the sink for hand washing, the taps that we should use, as well as the doors to the clean room shall be fitted with the interlocking system, yeah. And then in terms of door and windows, they have their own requirement, and the size of the door should be taken into account also. And I think I have to strengthen again about the class of the preparation room. If we are using the radiopharmaceutical aminoflow safety cabinet, we have to have a grade B clean room. But if you are using the grade D, sorry, if you are using the isolator, then you are allowed to use a grade D clean room. Okay. Obviously, you have to focus on the utility cabinet, workbench, and stainless steel sink, and also to identify on the material airlock, whether it's going to be a trolley height pass box with interlock door, or how to identify that the material can be transferred easily. And then obviously, adequate numbers of plug points shall be made available, and the QC room shall be built equipped with sufficient equipment and glassware, including radiation shielding such as lead glass and lead brick, and there should be radioactive sign or label for radiation working area. So if we're looking into the HVAC system, yeah, obviously it's humidity, temperature, pressurization, as well as air filtration or air cleanliness shall be controlled in order to protect the product, personnel, and also the environment. And due to consideration, it should be given in planning the placement of a room for HEPA filters and cabinets to be installed so as to avoid airflow obstruction, and diffusers shall not be used. Pre-filter, the primary and secondary of AHU and HEPA filters shall be changeable from outside the clean room, and the records need to be maintained. And so for the HVAC system, temperature should be not more than 22 degrees. Humidity is between 55 plus minus 5. And then equipment installed should not jeopardize the set room condition in terms of their temperature, humidity, air pressure, and the noise level. The air pressure shall be made higher in the cleaner grade of clean room. Recirculation of air extracted from the area where radioactive products are handled should be avoided. Okay. Radiation protection system shall be implemented to monitor any radiation contamination within the facility. Environmental monitoring system shall be in place, as well as those calibrators shall be properly shielded from the background activities influences. And this is a list of equipment required for the kit-based radiopharmaceutical facilities. And if you can see here, this is an example of layout plan for the kit-based radiopharmaceutical facility, where we have this changing room where we comes from outside of the area. We goes into the changing room, followed by gowning room, and then we've got this negative airlock. And then this negative airlock then we allow us to go to the kit-based radiopharmaceutical preparation. And next to it is the QC room, where you can actually give away some of the example for the QC being tested. And then you've got this component preparation room, whereby you're gonna use it for the entrance of the materials that you're going to bring into the clean room. So in terms of radio-labeled blood preparation, this is the principle of it. I don't think that is much different from what we have for the kit-based. But yeah, we have to bear in mind that we are allowed to prepare only one blood labeling procedure at one time, because we just don't want to have any cross contamination between the blood product. Necessary procedure shall be in place to avoid needle stick injuries. Obviously, control area shall be via a gowning area, and be restricted to authorized personnel only. And yeah, you have others that you can actually read later. And this is the layout, design and specification for the blood radio labeling facilities. The blood labeling preparation and kit-based preparation shall be performed in a separate workstation to prevent cross-contamination. Blood labeling and gowning room shall be of grade B if the laminar flow cabinet is used. Grade D is if isolator is used. And then the laminar flow safety cabinet or total containment workstation shall be used as a workstation. Environmental monitoring shall be in place to monitor the blood labeling areas from particles as well as bacterial contamination. So this is the list of equipment that are going to be used inside the blood labeling clean room. And this is an example of the radio label blood preparation facilities. Now we are going to the radio iodine preparation. So this is the principle of radio iodine preparation. We have to bear in mind preparation facility for oral radio iodine is only required if liquid dosage forms or combination of liquid and capsule dosage forms are being used. The preparation facility is not needed for radioiodine capsule. So if you just have a radioiodine capsule, you just need to have the dispensing workstation lah. Tapi this one, because it's a liquid, you're gonna have to do some manipulation sometime. So you might require preparation facility. Yeah. And yeah, I don't think there is much differences. You can have a read later. And this is the layout, design and specification for the radioiodine facilities. And this is the dedicated room that might needed for the radioiodine facility. Same goes to the adequate lighting as mentioned in the previous section. The electrical outlet shall be flush mounted, watertight, and have no crevices and shall be cleanable. And then I would say there's no much different from other requirement. You can have a read later. And this is about the facility requirement of those radioiodine preparation laboratory. So this radioiodine liquid shall be prepared in a controlled and unclassified area minimum of ISO class 9 lah. So it's an unclassified area. It does not category as in grade A or B or C or D, but it's under class unclassified areas of the ISO class 9. Okay. And then obviously preparation of radioiodine need to be done in the radioiodine fume hood equipped with the absorbent, either activated carbon or silver zeolite. Yeah. And then obviously separate toilet shall be provided for the use of patient, because we just don't want to have a very high radiation background level when the same user using the same the same area. So there shall be a lab barrier between dispenser and the patient in the radioiodine dispensing room. The dispensing of radioiodine for inpatient shall be done in the radioiodine ward, while the radioiodine of outpatient can be done in the dedicated dispensing room lah. It is recommended to provide dedicated routes so that the post-ingested radioiodine patient will not come in contact with other personnel and patients. These are the list of equipment required, and this is the example of layout plan for the radioiodine preparation facility. Okay, just not much change. I mean, this is how it looks like when we have the radioiodine preparation facilities. And in terms of the miscellaneous, we have this ready for use radiopharmaceutical, be it sterile products or unsterile product or non-sterile product. So, for example, the sterile product is unclassified controlled dispensing room for dosing or dilution shall be made available, equipped with appropriate equipment, and a dedicated room shall be provided for injection of radiopharmaceutical. In terms of non-sterile product, an unclassified room shall be made available for dispensing, meaning to open the container and checking of the activity, then immediately administered to the administering of the radioiodine capsule. In terms of sterile and non-sterile product, we have the unclassified controlled dispensing room, which shall be made available with appropriate equipment for both activities, either for dosing and dilution of radiopharmaceutical injection or opening of container and checking the activity of radioiodine capsule. And a dedicated room shall be provided for injection of radiopharmaceuticals and a radioiodine capsule. Both products can be administered in the same room. So, radiopharmaceutical for radioimmunotherapy, the preparation for radiopharmaceutical for the radioimmunotherapy can be shared with a preparation of kit-based radiopharmaceutical preparation room. So this is an analog for personnel and materials in clean room. So if non-sterile radiopharmaceutical preparation, you can see the airflow is coming from the airlock of the personnel or material to the production area. Whereas if it's a sterile radiopharmaceutical production or preparation, the flow should comes out from the production area to the containment airlock and negative pressure. Okay, hopefully you can understand it. Oops. With that, I thank you.